Whipple's disease. Whipple's disease is a very rare disorder which affects about 1 in a million people. It affects your gastrointestinal tract, or GIT. However, it can spread to other organs. This disease can be life-threatening if not caught early because it ruins your ability to break down food and absorb nutrients, which is vital for your body to function. It can also cause pain due to damage to the lining and walls of the GIT. Thankfully, we know what causes Whipple's disease and how to look out for signs and symptoms so we can catch it early before it spreads to other organs. A special bacteria called T. whippleri is the main culprit. It makes its way to your small intestine and damages its important mucous lining and wall, eventually creating a sore. The role of the small intestine is to further break down our food and absorb all necessary nutrients. The inner lining of the intestine is covered by small projections called villi, which absorb all the nutrients from our food. When the bacteria damages these villi, your body can no longer break down and absorb important things like fats and carbs in the damaged region. This leads to some signs and symptoms we can watch out for, such as the 3 main characteristics of Whipple's disease, which includes chronic diarrhea, sometimes with traces of blood, sudden weight loss from malnutrition as a result of not being able to absorb good nutrients, and joint pain. Some more signs and symptoms could include abdominal pain, stomach cramps, bloating, and fever. If any of these signs and symptoms concern you, you should definitely talk to a doctor about getting diagnosed. Whipple's disease can be diagnosed a few ways, but the most effective is through an endoscopy, which is a long, flexible tube with a camera at the end that is maneuvered down the throat by the doctor until it reaches your small intestine. From there, the doctor can identify any features and characteristics that can indicate the presence of T. whippleri bacteria, such as lesions. The doctor can also perform a biopsy, where tissue samples from different regions of the small intestine are taken and tests are performed to either confirm or deny the presence of the bacteria in question. If the tests come back positive, don't worry. The first step to fighting the bacteria is by administering patients with antibiotics intravenously for 2 weeks. The treatment is long-term, where patients must stay on antibiotics course for around 1 to 2 years to make sure the bacteria doesn't come back. Despite a lengthy treatment, signs and symptoms will cease early on, roughly a week after the start of treatment. For more information, consult with your doctor or visit the resources below. Thank you.